it actually seems really simple, and it is, right? It's simple to execute, but it's very flexible and nimble in being able to use how you want to look at something. And so you could look at something that is in particular to a program, a very specific aspect of it, or you could look at a longer process. So it allows you to ask questions and work through each of those subsections in a methodical way in how you're evaluating programs. And so in using an example from COVID around, broadband access, that would be an example of context, right? But it may not have been necessarily broadband that patients were lacking in order to participate in telehealth. But actually you wanted to focus more on the process, right? And so maybe there was some literacy or some education that needed to occur in order to educate patients on how to access it, or process efficiencies could be used by or built by using particular groups, or even changing the technology. And so really it's, CIPP, each stands for a particular part of the process. You can focus on just one piece, you can focus on all four, but it leads you through a series of questions that one might ask themselves in order to better understand what the work that they're doing. When I do a lot of my work with my operational teams, I tend to use a lot of methods like that, and a lot of even like design theory, where we're trying to look at a problem from different ways, as opposed to always prescribing the way in which we've always done something. I think a lot of times we get stuck in this rut where we continually apply the same types of solutions, only to find that we don't get better results, right? The definition of insanity. So it just gives us another way of looking at these types of processes. And it's a logic model. A lot of people associate it with education. I know I've shared with others in the past my background's in education, but I think that it's so important because it has so many threads to different industries and ways in which you can apply a lot of those theories and models to the work that we're doing. And if we think about it, right, we're all in this big learning game, if you will, how we learn and how we can motivate people to do the things that we need them to do in order to better their health. And so I really think that these types of theories and models are really applicable to the work that we're doing. And just to go off a little bit further on, that whole idea of like design thinking and using like the CIPP logic modeling with teams, just knowing that we're no longer an industry that's top down. We really have to look and see what our staffs are doing and empower them, and see how the work that they're doing and the ideas that they have can percolate up. I think that's how we get to a real change. And so these types of processes or program monitoring, right? So it's program building, but the assessment is also a key piece to make sure that it's working, I think are so important. And it's a great way to empower and involve your staff. It not only frees you up as a leader, right? But again, it brings new ideas into the mix, so that we're not incestuous and constantly bringing up the things that we've done, like I said, in the past that didn't always necessarily work for us.